What causes low oxygen levels in a child with bronchiolitis? Imagine a tiny airway in a child's lungs suddenly getting blocked or narrowed, making it hard for air to flow freely. That's what happens in bronchiolitis, a common lung infection in babies and young children. Usually caused by viruses like the respiratory syncytial virus, bronchiolitis causes inflammation and swelling in the smallest airways called bronchioles. When these airways swell, they become narrower, which means less air can pass through with each breath. The child may start breathing faster and working harder just to get enough air. Because the airways are so tight, less air reaches the tiny air sacs in the lungs called alveoli. These sacs are where oxygen from the air enters the blood. When fewer oxygen molecules make it into the blood, the oxygen level drops, leading to a condition called hypoxemia. Sometimes, mucus and debris from the infection can block the airways even more, making it harder for air to get through. This can cause the child to show signs of low oxygen, like rapid breathing, flaring nostrils, using extra muscles to breathe, or even turning a bluish color around the lips and face. Certain factors can make low oxygen levels more likely. Babies under 3 months old are at higher risk because their lungs are still developing. Children born prematurely or those with existing heart or lung conditions are also more vulnerable. A weakened immune system, exposure to tobacco smoke, or living in crowded places can increase the chances of severe symptoms. Most children with bronchiolitis have mild symptoms and do not experience low oxygen levels. But in some cases, the lack of enough oxygen can cause serious problems like respiratory failure, where the child cannot breathe properly on their own. This situation requires urgent medical care, often in a hospital, where oxygen therapy or even assisted breathing might be needed. Parents and caregivers should watch for signs of trouble, especially in very young children or those with risk factors. If a child is working very hard to breathe, not eating or drinking well, or showing signs of extreme tiredness or dehydration, they should see a healthcare provider immediately. Recognizing these signs early can make a big difference. In summary, low oxygen levels in a child with bronchiolitis happen because the infection causes swelling and blockage in the small airways, reducing the amount of oxygen that reaches the blood. Severe cases and certain risk factors increase this risk. If you notice signs of breathing difficulty or low oxygen, prompt medical attention is essential. Always consult a healthcare professional for personalized advice and treatment to ensure the best care for the child.